Dealing with a toothache and you don't know what to do? I'm here to help you. But the tips I'm about to share are not random internet hacks. They're home remedies that are fast, safe, and proven to work. After 16 years of clinical practice, this is exactly what I recommend to my patients. I'm going to walk you through 8 ways to soothe both tooth pain and gum pain, exactly how to do each one, and also what you should avoid. So, what can you do to relieve that horrible toothache? The first thing you should do right away, even before watching the rest of this video, is use a cold compress. Pause this and go to your freezer. Put some ice cubes in a plastic bag or grab an ice pack. Wrap it in a kitchen towel, then hold it against your cheek on the side that hurts. Then come back and watch the rest of the video. So keep the ice compress there for about 15 minutes, then take a 15-minute break before you use it again. The cold will reduce blood flow in the area, which helps bring down swelling and pain. The second thing you should do if you have severe throbbing tooth pain is not a kitchen ingredient. You need to take proper medication. Your best friend right now will be ibuprofen or Advil. Ibuprofen is especially effective for toothaches because it helps reduce both pain and inflammation. Paracetamol or Tylenol can also help, although it doesn't reduce inflammation. I'll explain in a moment what you can do if you don't have medication at home, or if for some reason you can't or prefer not to take it. But if you do have access to over-the-counter meds, that's the most effective way to control tooth pain. If you're not allergic, not pregnant, and don't have any medical condition and the pain is severe, it's often considered safe to alternate between ibuprofen and paracetamol. Always follow the instructions on the label or the ones given by a healthcare professional. This next one is not a remedy, but it makes a huge difference, especially at night, when you can't get help right away. So if that is your situation and you wake up in pain, try to rest with your head elevated. You can do that by adding an extra pillow or even sleeping in a more upright, seated position. When you lie flat, more blood flows to your head, which increases pressure and makes the pain worse. So, for severe tooth pain, ice compress, anti-inflammatory medication, and keeping your head elevated. This combo is your first-line approach for a toothache. But even those might not be enough. That big inflammation is often because of a large cavity, meaning your tooth has a large hole in it. If that's the case, there's another effective option. You can head to the ones we just talked about. Chances are you're going to need either a root canal or an extraction, but if you need immediate relief, you can also try clove oil. Dilute a few drops of clove oil in a teaspoon of olive or coconut oil. Soak a small piece of cotton in the diluted mixture and squeeze out the excess, so it's not dripping. Then place it gently into the tooth cavity for 5 to 10 minutes. Clove oil can temporarily numb a painful tooth because it contains eugenol, a compound dentists also use, but it has to be diluted, used briefly, and kept away from the gums. These are the things you can do for spontaneous, intense toothaches. But if your pain feels more gum-related, like food stuck between the teeth, or sore gums from gingivitis, or even inflamed gum pockets, the next tips will help you more. Start with a warm saltwater rinse. This is one of the simplest ways to soothe irritated gums. Mix half a teaspoon of salt into a glass of warm water. Not hot, just comfortable to hold in your mouth. Too much salt can irritate your gums, so more is not better. Take a sip, swish for a few seconds, and spit it out. Then repeat until the glass is finished. It's safe to do this several times a day, especially after meals. It helps loosen trapped food and makes our areas feel more comfortable. Now, food stuck between your teeth can be extremely painful. If you think that's what's going on, the best thing you can do is try to floss it out. Don't snap it down hard. Use a sawing motion, then curve the floss into a C shape against one tooth. Slide it gentle under the gum line, and then move it up and down. If the space is wide and a lot of food is coming out, you can tie a knot or two in the floss to help pull the debris out. If the floss won't go through at all, don't force it. Try an interdental brush instead. It's normal for it to bleed, sometimes a lot, because the gum is inflamed. Just keep going gently until the area is clean. Then rinse with warm salt water. You can also get some gum relief from hydrogen peroxide. Mix 1 part hydrogen peroxide with 1 part water. Take a sip, rinse once, and spit it out completely. Then rinse with plain water afterward. Don't use this more than twice a day, and only for 1 or 2 days. If you use it undiluted or too often, it can damage your gums and disturb the good bacteria in your mouth. And the last one is peppermint tea bags. Peppermint tea bags are a low-risk option, and they also give pretty mild relief. A room temperature peppermint tea bag can soothe gum discomfort because of menthol's cooling effect. Just soak the bag in hot water, let it cool completely, and hold it against the sore area. Now, you should know that some home remedies can actually make things worse. You'll see a lot of popular online fixes like garlic, vanilla extract, essential oils, or even alcoholic drinks. And while some of these can kill bacteria in a lab, that doesn't mean they help a toothache. Yes, I know garlic has allicin, which is known for its antibacterial and anti-inflammatory effects, but your mouth isn't a petri dish. Fresh garlic can actually increase local inflammation and burn your gums, so it can be really harsh on already sore tissues. I personally stay away from all of them. Another thing I've seen online is people suggesting you crush aspirin and put it directly in the sore area. Please don't do this. Aspirin only relieves pain when you swallow it. If it sits on your gums, it can chemically burn them and leave you in even more pain. And this is very important. There are symptoms that are not safe to manage at home. If you have swelling on your face, fever, bad taste or pus, or difficulty opening your mouth or swallowing, those are signs of a serious infection and they require urgent medical care. Also, I must warn you that if you have severe tooth pain for 1 or 2 days that suddenly stops after home care, this does not mean the tooth healed. It usually means the nerve died and the infection is spreading. So you should absolutely see a dentist even if you're not in pain anymore. And please don't forget that these tips are for temporary pain relief only. These remedies only help with symptoms. They don't treat the cause of the problem. Now, I hope you feel better and that this video helped you. If you know another safe way to relieve tooth pain quickly at home, write it in the comments so you can help others too. And if you're unsure what to do next, this video can help you decide between a root canal and an extraction. Don't forget to subscribe, and I'll see you on the next one for another fresh take on every bite.